In a striking blow to the Biden administration's attempt to fight the pandemic, the Supreme Court today overturned the president's requirement for employees at large companies to get vaccinated or test for COVID routinely. The court did, however, leave Biden's vaccine mandate for some healthcare workers standing. The employer mandate from the Occupational Safety and Health Administration began to take effect only 3 days ago. It applied to 84 million Americans working at private companies with more than 100 employees. But that was not cutting it for the conservative-leaning court. Although Congress gave the administration emergency powers to regulate occupational dangers, quote, it has not given the agency the power to regulate public health more broadly, end quote, the justices wrote in an unsigned opinion today. The court's decision comes just as things were starting to look up in the Northeast. The surge in Omicron cases and hospitalizations appears to be slowed in New York this week. Even though the number of cases remains high, the state's governor on Tuesday said New York appears to be cresting.
We are not at the end, but I wanted to say that this is, to me, a glimmer of hope at a time when we desperately need that.
Infectious disease experts were stunned on Tuesday to see COVID levels fall in the city's wastewater tracker, giving a promising indicator for future virus cases in the area. The rate of teachers testing positive has fallen at the Children's Hospital of Philadelphia from 25% during the holidays to 2% in recent days. Pandemic forecasters predict the same will happen in the mid-Atlantic, though the overload in hospitalizations has prompted New Jersey, D.C., Maryland, and Virginia officials to declare states of emergency. Does all this call for some cautious optimism? Joining me now to discuss is Dr. Stella Safo, founder of Just Equity for Health and HIV primary care physician. So, Dr. Safo, what do we make of this? Does it look like some of these cities in the Northeast are seeing their peaks of this Omicron wave, and are we on the other side of it?
So I think it's always really dangerous to start to talk about COVID as though we can anticipate what it's going to do, because every time we try to get ahead, it just kind of swerves and does something different. I think if we look at what's happened in South Africa and what happened in the UK, we know that the Omicron surge tends to be over the span of weeks rather than, let's say, months that we saw with Delta. And so it makes sense that we're anticipating that we're going to peak for New York fairly soon, and then things will start to come down. While that is the case, the reality of the matter is that a peak means that a ton of people are infected still, that community rates in some areas are over 30%, 40% in some other areas. And so if I were listening to this, I would take it as, we heard a glimmer of hope, but I wouldn't relax any of the measures that I'm doing of wearing high-grade masks, of avoiding crowds, of just trying to be as careful as you can, because you could still get infected. The rates are still incredibly high.
Places like New York have very stringent COVID rules. You have to show vaccinations to enter restaurants and health clubs and what have you. You have to wear a mask everywhere, it seems. That is not going to be the case in many of the states where governors are kind of combative with the CDC. How do we expect this to roll forward if, in fact, we are seeing some sort of peaking and cresting?
You make such a good point. So what we've seen in New York is that New York kind of got bowled over by this latest surge. Many of us just weren't expecting it to be as bad as it was in terms of the numbers of individuals that got infected. And yet the thing that we have in New York, exactly as you've said, is we have quite a high number of individuals who are vaccinated. I think over 70% of our population has gotten vaccinated. Imagine in a place where you see Omicron spreading the way it's spread in a highly unvaccinated population, which is what we know we'll see in the Mid-Atlantic, in the Midwest, down south, parts of the West Coast. It's just going to be devastating. And so it really speaks to take New York as kind of the warning. That's what happened early on in the pandemic. You saw what happened in New York, and then it spread to the rest of the country. You see what happens in New York now. And as you've said, we mask, we vaccinate, we do the best that we can. And Omicron still kind of brought us to our knees. And so if you're in a place where you're not vaccinated and you're not, you don't have mask mandates in place, you got to really think about how you're going to keep yourself safe in the coming days and weeks.
So I want to focus on a specific state. Today, the Minnesota Health Department removed race as a factor for distributing antibody treatments. Yet today's data shows that black people make up 11% of the state's hospitalizations, even though they're only 6% of the population. Is it wise to start disaggregating, or kind of eliminating race as a factor when we're talking about how we treat the disease?
I mean, it's one of those moments where you really want to ask, make it make sense, right? Like you create your measures in a way that responds to the reality. And the reality is you have a group that is overrepresented in the numbers of individuals that get COVID, that are hospitalized for COVID, and that die from COVID. And so to know that the Black population is at a higher risk and to not take that into account as you're designing your COVID management strategies is quite frankly irresponsible. And many of us that are looking at this from the public health perspective are really upset by this because you want, health equity means that you target the groups that are at highest risk for certain conditions and you bring them the resources and the help. And in this case, that would mean that they would have said, actually, let's factor in race when we're thinking about prescribing Paxlovid, monoclonal antibodies, et cetera. And to remove that it simply does not make sense.
So now a model by the University of Washington predicts that COVID cases will crest nationally by January 19th. That's very soon, right? So that's middle of next week. I think that's Wednesday. Assuming that actually happens, which is hard for me to believe that it will, is there a danger in that too? The last time we saw a crest that was in Delta and things started to go down, people relaxed. Fewer people, felt the need to go out and get their boosters or get their second shots or even start to get their first shots. People, start to take off their mask. I live in a building where the policy of mask wearing changes all the time depending on how many cases there are in the direction of the surges. So is there a danger in a national cresting, but regionally and in specific cities and specific states, you would have a raging virus still?
Absolutely. I mean, Charles, you've said it. It doesn't make any sense for us to try to predict how all of these things are going to go when honestly, again, historically, we have tried to get ahead of what COVID will do and it has, acted in a different way. We're not going to be able to be confident and let our guard down honestly, until most of the world is vaccinated. And we're not making steps to make that happen. And so, sure, maybe some miracle will happen, which, I think we deserve. And it would be amazing to see that the country starts to get better after January 19th. But none of us, I think, that are looking at this are holding our breath. Continue to mask and just try to be as safe as you can.
Dr. Stella Safo, thank you again for joining us again tonight.